The home health nurse reviews the types of insulin prescribed to the client diagnosed with diabetes mellitus type 1. Which of the following insulins experiences peak action between 6–12 hours? A. Glargine. B. Lispro. C. Regular. D. Isophene, NPH. E. Aspart. The answer is D. Isophene, NPH. It is essential for the nurse to know the onset, peak, and duration of actions for all types of insulin. Rapid-acting insulins Lispro and Aspart have an onset between 10 to 30 minutes, peak between 30 minutes to 3 hours, and have a duration of 3 to 6 hours. Regular insulin has an onset between 30 to 60 minutes, peaks between 1 to 5 hours, and lasts 6 to 10 hours. Intermediate-acting insulin's Isophene, NPH, has an onset between 1 to 2 hours, peaks between 6 to 12 hours, and lasts 16 to 24 hours. Very long-acting insulin Glargine has an onset between 3 to 4 hours, does not peak because it works continuously, and lasts 24 hours. The answer is C. Tiotropium. Albuterol, terbutaline, and Salmeterol are all beta-2 adrenergic agonists. Beta-2 adrenergic agonists are a drug class used as mainstay treatments for respiratory diseases such as bronchial asthma and chronic obstructive pulmonary disease, COPD. They replicate the functions of catecholamines such as epinephrine, norepinephrine, and dopamine in producing different autonomic responses within the body. Beta-2 adrenergic agonist. They stimulate beta-2 adrenergic receptors, causing smooth muscle relaxation in the bronchial passages. Tiotropium, trade name Spiriva, is an anticholinergic bronchodilator. All of the following are examples of adrenergic agonists except dash. A. Terbutaline. B. Salmeterol. C. Tiotropium. D. Albuterol. Which of the following is an example of an inhaled steroid used in the treatment of asthma? A. Salmeterol. B. Fluticasone. C. Ipratropium. D. Tiotropium. The answer is B. Fluticasone. Fluticasone, trade name Flovent, is a synthetic glucocorticoid used in the treatment of asthma and allergic rhinitis. Tiotropium, trade name Spiriva, and Ipratropium, trade name Atrovent, are both anticholinergics, and Salmeterol, trade name Serevent, is a beta-2 adrenergic receptor agonist. What class of drug is montelukast? A. Long-acting beta-2 agonist, LABA. B. Anticholinergic bronchodilator. C. Leukotriene inhibitor. D. Corticosteroid. The answer is C. Leukotriene inhibitor. Montelukast is a leukotriene inhibitor. It acts by antagonism of the leukotriene receptor sites in bronchial wall smooth muscle to prevent wheezing, chest tightness, and coughing caused by asthma, and to treat other respiratory issues to promote proper ventilation. Each of the following antibiotics works by inhibition of the 50S subunit of bacterial ribosomes except ASH. A. Macrolides. B. Clindamycin. C. Streptogrammin. D. Tetracyclines. The answer is D. Tetracyclines. Macrolides, streptogrammins, and clindamycin all work by inhibition of the 50S subunit of bacterial ribosomes. Tetracyclines have a similar mechanism of action, but instead affect the 30S unit of bacterial ribosomes. Polymyxin antibiotics target what part of the bacterial cellular anatomy? A. Nucleic acids. B. Ribosomes. C. Cell wall. D. Cell membrane. The answer is D. Cell membrane. Polymyxin antibiotics function by interfering with phospholipid function in bacterial cell membranes. After binding to lipopolysaccharide, LPS, in the outer membrane, polymyxin's hydrophobic tail causes damage to both the inner and outer membranes of gram-negative bacteria. What is the mechanism of action of amoxicillin? A. Interference with the 50S subunit of bacterial ribosomes. B. Inhibition of bacterial cell wall synthesis. C. Interference with the 30S subunit of bacterial ribosomes. D. Suppression of folate synthesis. The answer is B. Inhibition of bacterial cell wall synthesis. Amoxicillin inhibits bacterial cell wall synthesis by interfering with the formation of cross-links between peptidoglycan polymer chains. Which of the following class of antibiotics is associated with ototoxicity and hearing loss? A. Quinolones. B. Beta-lactam antibiotics. C. Aminoglycosides. D. Glycopeptides. The answer is C. Aminoglycosides. Aminoglycoside antibiotics such as streptomycin and gentamicin have been associated with vestibular toxicity and hearing loss. Aminoglycosides remain in inner ear fluids longer than serum and can have a latent ototoxic effect, causing hearing loss even after the antibiotic has been discontinued. None of the other antibiotics listed are associated with ototoxicity. Ciprofloxacin belongs to what class of antibiotic? A. Tetracyclines. B. Beta-lactams. C. Fluoroquinolones. D. Macrolides. The answer is C. Fluoroquinolones. Ciprofloxacin belongs to the fluoroquinolone class of antibiotics. Other antibiotics in this class include norfloxacin, levofloxacin, and natafloxacin. What is rifampin's mechanism of action? A. Disruption of cell membranes. B. Inhibition of DNA gyrase. C. Inhibition of RNA polymerase. D. Inhibition of the 30S subunit of bacterial ribosomes. The answer is C. Inhibition of RNA polymerase. Rifampin inhibits bacterial RNA synthesis by inhibiting RNA polymerase. This prevents the transcription of proteins within the bacterial cell, leading to cell death.